Well, today's Thursday. The surgery was Tuesday, so this is day 3. And in the last video I made, which was the day of the surgery, I had told you some questions that I asked the anesthesiologist when he came in, but I forgot to tell you the questions that I had for the surgeon when she came in to mark up my hand. So one thing I wanted to know, she had said at my first appointment that the hard cast would be on for 5 weeks. I thought, wow, 5 weeks. And so I wanted to know, because afterwards I realized that this splint thing that's on here now, this kind of bandaging, if you can see it, that's going to be on for 14 days before my follow-up, because then they have to take the stitches out and stuff, and that's when they're going to put the hard cast on. So I wanted to know, is it 5 weeks from then? And she says, no, it's only 3 more weeks after that. So really, it's only 3 weeks with the hard cast. It's 5 weeks total, including this that's on here now. And what else did I ask her? I wanted to know when I could exercise, when I could drive, stuff like that. She said I could drive whenever I want, whenever I feel like it, because these fingers I can move these fingers, but I just can't move my thumb. And so if I can hold the steering wheel with those fingers, when I feel up to it, I can drive. And as far as exercise, she said I could do whatever I want, whenever I feel like it. So I haven't felt like it, trust me. It just hurts. And I did get this block, this foam. It's foam. I don't know if you can see. It's like an arm elevating thing. So I use this to sleep and to sit. And if I don't have my arm elevated, it really starts to hurt right away. So I don't know I did go for a short little walk today. So that was the beginning. I'd planned to get back up to more exercise. But what else did I want to know? I asked her, because I had watched a video of somebody doing this procedure, watching the whole procedure. And in that video, they put in a screw somewhere, like to anchor the little anchovy thing that they make out of the tendon. And you could see the guy pushing in this screw, and it said that it dissolves into the bone eventually. And I asked her, and I had read that there was another thing that is done sometimes using things called K-wires. And that leaves these wires sticking out of your skin after the surgery, and then they have to eventually remove those. So I asked her which way was she going to do it, because she hadn't, said. I didn't know exactly what her procedure was. And she goes, I don't use either one of those things. And she said that most doctors don't have the technical ability and skill to be able to do this much less invasive thing without using a screw or anything. It's just a method of suturing that anchors that thing, the anchovy, they call it, in there. So that's what she's going to do. And she has a really great reputation for being excellent. And she's quite confident, and she doesn't mince words about the skill that she does have, and I believe her. She did my sister's surgery in 2021 or something on a contracture release or something like that. But so I was glad to hear that. I told her about the video I watched, and she said that she needs to make her own video, because there's so many different little variations in how different doctors do this surgery, and they're just not all the same. And so she said, I need to make one that shows how I do it, which would be great. A little late for me, but anyway, so now on day 3, I have to say it is way more painful than I expected. It really, really hurts a lot. I've been taking my pain meds. I have Tramadol, I think it's called. It's not as strong as Vicodin, but it does cause constipation, which I hate. But I've been taking it because it hurts a lot, and the medication knocks me out a lot, so I sleep a lot. This block thing is a lifesaver. In bed, it works out great, and I actually had a great night of sleep last night with this. But this morning, I woke up, and I guess because of the great night of sleep, I felt better this morning and decided to forego the pain med because of the constipation, which I wanted to alleviate. And so that did help. I had things happening in that area, but now it's starting to hurt again. And so I'm thinking, should I take it again? I haven't decided yet, but it's definitely painful. But it is, I think it kind of turned a corner today compared to the last 2 days. It is not quite as bad. So I'll let you know in a few more days how things are going.